Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Today, I've been given an opportunity to present the manuscript of articles that me and my two other colleagues have been writing for the International Conference on Economics and Business of Mandala Higher Education in Lumajang, East Java Province, Indonesia. This video will be at least running on 10 minutes and no more. And during that time, I will be presenting about the whole thing of what I have and my colleagues have been putting an effort in research. So the article has a title of Community Satisfaction Index in Healthcare Service Community Central Health Service in Maron, Probolinggo. Or in other words, in Indonesia is about Indeks Kepuasan Masyarakat di Puskesmas Maron, Probolinggo, Indonesia. The first author is Hermanto, and second author is me, Reni Chandra Dewi, Puspita Reni, and third author is Dr. Ngatimun, SAMM. We are collaborating, which is the first author is basically has the basic education, has a basic knowledge of management, and he is currently in Faculty of Economics in Universitas Pancamarga. The same with the third author. Meanwhile, I'm from the social and political science. So actually, this is a research of two big disciplinary in our university. Next. Okay, introduction. Public services in the paradigm of social and political science is regarded as the spearhead of the local government. And then it plays a very central role and is very close with the community in order to bring community into a life that is healthier and also to increase the life standard of the community itself. So the basic services delivered by the public services, especially in the healthcare services, is to bring the community healthier from time to time. And these are the services that has been delivered by the community health center, or in other words in Indonesia, Puskesmas Maron, Probolinggo. Healthcare services is one of the most significant services because they deliver and most concerned with the community health system. They are meeting with each person and each individual in community, and they are mostly operating in a very remote area or moderate remote area. So what makes this research different from others, but I also believe that it's very common in the field of public administration, when we public administration and management, when we also conduct the same research. This research is made based on regulation of the Permenpan RB number 14 year 2017 about the guidelines of Community Satisfaction Index, or is abbreviated as CSI, Public Sector Unit. So because it is mainly concerned with the public sector, we do not use the 5 aspects most recently used in order to conduct Customer Satisfaction Index. So there's a difference between Community Satisfaction Index and Customer Satisfaction Index. In management, we are using Customer Satisfaction Index that is based on the 5 aspects that will help us to generate the surveys. But in Community Community Satisfaction Index, we are using the government regulation, the central government regulation. So that is the difference between my research, our research, with the rest of the research. Recent studies about Community Health Index community satisfaction index are very large and very wide. So I did not cover all the recent studies about it, but I only cover what matters. So first is CSI has been used as one of the tools. So there are wide variety of tools to measure the community satisfaction upon which public services are delivered. And CSI has been used in research by my research with my students in 2020 to identify the score of community satisfaction index in city library services, which is concluded good, but there are some remarks. And also CSI has been used in researchers of Haryani, Sukanti, Wahid, Widnyana, Nopianti, Fitria, and Safriana till 2020. And there are very important remarks made by Ekadipta in 2019 and Sularsi in 2019 as well, where community health center is measured and result to community satisfaction index in medicine receipt information and outpatient services. A very strong remark about TSI and importance performance analysis, on which the analysis that we will be using in the research have been made by Ivan Severe in 2015, where to consider analysis to make the analysis more rigorous or more complete. So Severe has a very updated, I would say updated methodology that probably in the future will make our analysis more complete. What can we infer from the previous studies? So my studies has been using the same regulation because we are measuring community satisfaction index to compose surveys and measure the CSI. Haryani and the rest until Safriana have utilized the 5 aspects. I believe this must be 5 aspects that include tangible aspect, reliability, responsiveness, assurance, and empathy. These 5 aspects are widely used in a customer satisfaction index, which is a little bit different based on the guidelines that we are using. But there are some weaknesses in this because the services are too general or not very specific. While the specific the specific services that have been measured and result to CSI have been used by Ekadipta and Sularsi in 2 sections of the general services in the hospital, which are medicine receipt information and outpatient services. An updated of this methodology where community satisfaction index is used, added with importance performance analysis or IPA is being, I did not say, I wouldn't say being criticized by Severe, but what Severe did is to complete and to make the analysis more rigorous, more to become rigorous studies. That is by aided or integrated with a receiver operating characteristic analysis, which we will understand, or if I still have the time, to explain it, how it will complete our analysis in a discussion course. So these are the methodology, because we are measuring community satisfaction index. We started or initiate the research by evaluating and measuring the TSI using the above mentioned regulation, which is Permenpan RB number 14 year 2017, we can identify what units are being measured. So using that regulation, there are 9 units are being measured. Those are requirements, procedures, service time, fees, rates, product specification for service types, implementer competencies, implementer behavior, complaint handling, suggestion and inputs, and the last, health facility conditions. Each of these units are symbolized from U1 to U9. Okay, next, we are using these units to compose surveys and questions of what we need to know, and then to score them in a balanced measurement. The balanced measurement, yeah, we need a balanced measurement according to what the regulation has directed us to do. And after that, we do an IPA, which result or generates the 4 diagram Cartesian diagram of explanation. So this will be the measurement that we have used. CSI is measured by the total of 150 respondents of users that are defined as respondents that were randomly selected as they are receiving services, visiting and or having experiences in Puskesmas Maron. An aspect of importance, which is part of the IPA, is made as a total of respondents scored by 5 scale of Likert. First one is very important, third is quite important, fourth less important, fifth is not important. And B, the aspect of performance is a total respondent scored by 5 Likert scale, which include very good, good, quite good, less good, and not good. So we are gonna measuring all the scores from U1 U9 using this scale. These are the results. So requirements. The CSI result, we are using a balanced average value. Result to 8.426, and until the total community satisfaction index is 74.926. And the user expectation index, this is the importance analysis. For the importance analysis, result 2 as follow. And this, the table 3, is how we compare the X, the importance, and the X, the performance, and the Y, the expectation of which importance are constructed. So they are the values, and the formula will be the X divided by Y, which is, for example, in U1 requirements, the total value is 435. An average value is 3, while the Y expectation is 510. So the degree of adjustment will be X divided by Y and result to 89.216, so on and so forth. We do from U1 to U9. And what is the very important about importance performance analysis is the scale means. The scale means is used to define the line, the red line, the dotted red lines on the right picture. I don't know why I cannot point really cannot point. I cannot point on the anyway, the average, the scale mean of the expectation, which is reflected on Y line, is 3.35. It is on the average of expectation, the Y expectation. I wonder why I cannot. And the performance average value or scale means is 2.0 0.9, which is the average value from U1 of X performance to U9. So that is important point of how to make a Cartesian diagram of IPA. So what we can conclude is U1 and U2 belongs to the quadrant 1, which is aspects that must be maintained by the manager or by the public services. And the quadrant 2, that means very excessive, or excessive. That is a product specification, which means that manager or public sector should less concern on the U5, on the product specification for service types, because the users think that this is too much and is less important to the public services. So the recommendation for the manager is to become less concerned about this and more concerned with the quadrant 1, which is aspect must be maintained, include on the requirements and service procedures. The rest of the quadrant, which is 3rd and 4th, will give another explanation and another recommendation. So actually the point of importance and performance analysis is to generate recommendations of which manager are able to identify the aspect they need to improve. And in quadrant 4, which is primary priority for the manager, which means a recommendation for manager to a very concerned about these matters will include on service time, implementer competence, implementer behavior, and the last is complaint handling. So the manager must focus on those 4 aspects. While another recommendation, but would be a recommendation for lower priority for manager, is including on the U4, which is fee and tariff, and U9, which is health facility conduction. What I have been explaining in the relation of expectation and performance in the importance of performance analysis is concluded in the explanation of this slide. This is too much of words, but I feel the need to put all of them. So to make it, the explanation is not gonna be less explained, kind of like that. So the conclusion is public sector organization has a wide range of services. Okay, if the measuring of satisfaction indexes has two directions. The first one is it for community, and the second one, is it for a customer? It's for a community. I would strongly suggest to use the Permenpan RB number 14 year 2017 as the guiding rule. At least we have a very standard minimum on what we are looking to, on what aspect we are looking to. Standard minimum. I call it a standard minimum because researchers are free to make a modification adjustment. If we look at satisfaction index in customer, most importantly in the field of marketing, then probably we should look at guidelines to use 5 aspects or more. Anyway, either method combined with importance performance analysis is quite a simple methodology to generate recommendation for the manager of public services. So it's very simple. Why? Because it is quite simple to initiate. It also generate a fundamental recommendation that is usual. But according to Xavier, I would agree with him to say that the analysis must be completed more or updated, because there are some weaknesses in IPA or important performance analysis. Then that I believe these weaknesses are these weaknesses can be covered by using another analysis, second analysis, which is RAOC. So the recommendation for the further research is to analyze the community satisfaction index or customer satisfaction index with IPA, but aided with another analysis of ROC. So that's probably the conclusion of the research that we have been conducting, and probably will also mark as the end of my presentations. And I really welcome for the remarks, inputs, and any thoughtful recommendations of this research. Thank you for the time, and I should say wassalamualaikum warahmatullahi wabarakatuh.